Welcome. I'd like to demonstrate this really useful technique for dealing with floppy iris from like Flomax, and chronic glaucoma tends to have this as well. I'm going to speed up this initial section so we can get to the point of interest here. These iris can be really challenging situations. Once they start coming out the wound, it becomes awful to manage with a lot of damage to the tissue. So I'm going to show you. Here we go. We start off with the hydrodissection, and then I notice there it is. So you have to stop at this point. It's very important you don't keep going. Notice right there, the iris is trying to come out the wound. So I have not completed a thorough hydrodissection. We can't proceed with the case. Here we reposit the iris back in with a little viscoelastic, and then here's the PhacoHydro technique. So by blocking the wound with the phaco probe, the iris cannot possibly come out. We're also re-establishing a different flow of fluid. So the phaco is put on irrigation mode, and then we go in through the side port with the hydrodissection. So this is PhacoHydrodissection. There's actually no phaco energy being used. This is just irrigation, and I'm using the phaco probe to block the wound so that the iris stays in place. And you can notice now it's nice and controlled. The iris has no tendency to go out the wound because it cannot, and the fluid is going back into the phaco tip in the center, which also helps keep the iris going in the right direction. So that was attempt number one. Here comes PhacoHydro attempt number two. And the goal here is, again, we're going very, very slowly, very gentle. I'm not trying to blast it really hard because these eyes tend to have fibrous adhesions. Notice how we don't see a fluid wave. We will not. There's just too much fibrous capsule and cortex. So going very gently. I'm trying to rock. I notice I'm still not quite there. Try a little bit more, and eventually I'm going to run out of fluid again. So I'm going to hand it off, get a reload for a third try. I'm going to go in again, try to go all around, and once I see that I get a decent movement, there we go, we're starting to get some movement now. So it doesn't matter how many times we have to do this, the chamber is nice and stable thanks to the phaco probe blocking the wound. We can do as much hydrodissection as we need, and I will do as much as I need. Take my time here. This is the point of being very meticulous and slow. It will make the rest of the case go very nicely. Here I've sped up the MyLoop because I have other MyLoop videos if you want to see more about the MyLoop technique. But I find the MyLoop is excellent to complete any last remaining lysis of adhesions and free up the nucleus 100%. It also obviously sections the nucleus so that there is less phaco energy and phaco time needed. These cases just have a tendency to go south really fast, and anything I can do to speed that up is useful. Notice here the myostat's going in through the wound first. This is really important. Do not go in through the para first, or your iris will come flying out at you. Go in through the wound first, get the myostat going, keep the chamber stable, and then deepen the chamber through the para. Alrighty, I hope these are useful techniques. I have found them extremely valuable in the floppy iris glaucoma eyes especially.